Good morning, everyone. Today we will study together Chapter 15, Assess the Ability Level of the Elderly. I am your presenter, Tan Yukin. The learning objectives for this lesson are to master the fundamental steps in assessing the abilities of older adults, understand the principles of level adjustment, comprehend the factors influencing assessment outcomes, and develop critical thinking skills through case analysis. Through today's instruction, we aim to provide you with a comprehensive and clear understanding of the older adult ability assessment process. Today's lecture is primarily divided into 3 sections. 1. Procedures for assessing the ability levels of older adults. 2. Principles for adjusting ability levels. 3. Key factors influencing assessment outcomes. Finally, we will engage in reflection and discussion based on case studies to help consolidate the knowledge acquired. We now proceed to the first section of our study. Assessors should determine the older adult's capacity level according to the following steps. 1. Calculate the scores of the 4 primary indicators. Add the scores of the 8 secondary indicators in self-care ability to get the total score of self-care ability. Add the scores of the 4 secondary indicators in basic motor ability to get the total score of basic motor ability. Add the scores of the 9 secondary indicators in mental state to get the total score of mental state. Add the scores of the 5 secondary indicators in perception and social participation ability to get the total score of perception and social participation ability. 2. Assess the preliminary level of ability. Add up the scores of the 4 primary indicators to obtain the preliminary level score, and then assess the preliminary level of ability of the older adults according to the classification standard of older adults' ability level. Subsequently, we reference nationally or industrially established classification standards for ability levels of older adults, comparing this composite score to determine the appropriate ability level. These levels are typically categorized into 4 classifications: intact ability, mild disability, moderate disability, and severe disability. The preliminary level assessment serves as the foundation for subsequent adjustments and final level confirmation. 3. Adjust the ability level. Adjust the ability level of the assessment subject according to the basis for the change of the ability level of the older adults. 4. Assess the final competence level. Based on the assessment results of the preliminary competence level and the basis for changing the competence level, assess the final competence level of the assessed object. The final level is derived by integrating adjustment results with the preliminary classification, thereby more accurately reflecting the actual living condition of older adults. It should be noted that the final assessment outcome directly influences the older adult's eligibility for corresponding care services and policy support, rendering its accuracy paramount. We now proceed to the second section of our curriculum: principles for adjusting ability levels of older adults. Under what circumstances should preliminary levels be adjusted? Primary scenarios requiring adjustment include: if the person being assessed is in a coma, has been diagnosed with dementia F00, F03, suffers from other mental and behavioral disorders F04, F99, or has experienced 2 or more care risk events within the past 30 days, it indicates that their function in some aspect is impaired. In this case, the ability level of the person being assessed needs to be adjusted. Specific adjustment criteria are as follows. 1. Coma. If the subject is in a coma, it indicates that they have completely lost consciousness and their somatic, sensory, and limb motor functions are severely impaired. In this case, their ability level can be directly assessed as completely lost. 2. Diagnosed with dementia F00 to F03. Dementia patients typically experience cognitive impairment, primarily manifested as poor attention, decreased learning and memory abilities, reduced comprehension of language and facial expressions, and poor orientation in time and space. The specific symptoms vary depending on the underlying cause of dementia. If an individual is diagnosed with dementia, their initial cognitive level needs to be raised by 1 grade. 3. Suffering from other mental and behavioral disorders F04 to F99. If the person being assessed has other mental and behavioral disorders F04, F99, it indicates that they have varying degrees of impairment in cognition, emotion, behavior, and will, making it difficult for them to communicate with normal people. And they may even exhibit extreme behaviors that harm themselves or others. If the person being assessed is diagnosed with other mental and behavioral disorders, their initial ability level will be raised by 1 level. If 2 or more care risk events have occurred in the past 30 days. Care risk events mainly include falls, choking, suicide, self-harm, and getting lost. If the person being assessed has experienced 2 or more of these care risk events within the past 30 days, their initial competence level should be raised by 1 level. Evaluation work often encounters various interferences. In this 3rd section, we analyze factors influencing assessment results. 1. Response inconsistency. The discrepancies between the assessment subjects and their families/caregivers' answers to the same questions posed by the assessor are mainly due to misunderstandings and intentional concealment. In such cases, the assessor needs to make a comprehensive judgment based on common sense experience and the actual circumstances of the assessment subject. 2. Unstable medical conditions. The abilities of the individuals being assessed vary at different stages of their illness. To ensure the accuracy of the assessment results, for the older adults, assessors should, as far as possible, conduct the assessment after the individual's condition, especially mental illness, has stabilized. 3. Providing false supporting documents. Some individuals being assessed, along with their families, may provide false supporting documents to assessors in an attempt to raise or lower their competency rating. If assessors discover such a situation, they should first communicate with the individual and their family, and if necessary, verify the information with community or street-level staff before completing the assessment. if uncooperative with the assessment personnel. The assessment recipient may not understand the significance of the older adult's ability assessment, or the assessment may take too long, leading to the recipient's lack of cooperation. In such cases, the assessor can patiently explain the relevant policies regarding the older adult's ability assessment and the benefits it brings to seniors, thereby gaining their cooperation. We now proceed to the overview question section. Assessor Xiao Li conducted an ability assessment on Grandpa Wang. Grandpa Wang's initial assessment score was moderate disability. His daughter revealed in an interview that Grandpa Wang had gone missing twice in the neighborhood within the past month, but emphasized that my father is very healthy, just a little senile. However, when speaking with Grandpa Wang alone, he vehemently denied this, displayed agitation, and refused to continue cooperating with the assessment. Based on what you have learned in this lesson, please think about and discuss. First, assessment adjustment, judgment based on the assessment principles. Does Grandpa Wang's initial assessment level of moderate disability need to be adjusted? What is your basis for this assessment? Second, analysis of influencing factors. In this case, what factors might influence the assessment results of the older adult's ability level? How do you think these factors should be properly addressed? Third, comprehensive decision-making. If you were Assessor Xiao Li, what steps would you take next to ensure the accuracy and fairness of the final assessment results? This concludes the main content of this lesson. We have covered the procedures for determining ability levels in older adults, the principles for level adjustment, and common factors influencing assessment outcomes, all reinforced through case analysis. The assessment of older adults' abilities is not merely a technical task. It directly impacts whether older individuals can access appropriate care and services. We hope you will continue to reflect on these concepts after class and apply them in your future studies and professional practice. Thank you all.